Dear students, welcome back. In the previous session, we have seen the structure of the elbow joint part 1. Now we are going to see the structure of the elbow joint part 2. It includes the joint capsule and the ligaments around the elbow joint. Out of these two, now we are going to see the joint capsule of the elbow joint. The joint capsule is a fibrous sac enclosing the joint cavity. The inner surface of the capsule and non-articular bony parts inside the capsule are lined by synovial membrane. And the anterior and posterior parts of the capsule are sometimes described as anterior and posterior ligaments of the joint. And this capsule not only enclosing the elbow joint, but it also enclosing the proximal radio-ulnar joint. So the proximal radio-ulnar joint is also having a common capsule which is enclosing the elbow joint. Okay, that is one of the additional thing we can see here. Normally each joint will have a separate capsule, but in this elbow joint it also covers the proximal radio ulnar joint. Okay, now coming to the attachments of the capsule, it is having an attachments above the joint and below the joint on both anterior side as well as the posterior side. And if you see the attachment on the upper part, that is above it is attached to the medial epicondyle. Here you can see medial epicondyle. Upper margins of olecranium on the posterior side, upper margins of the radial and the coronoid fossa, as well as some part of the lateral epicondyle of the humerus. This is the above attachments, and below it is attached to the anterior medial. So this one is anterior and medial margins of the coronoid process, and also the upper margins of the annular ligament. Here we will have this annular ligament, upper margins of the annular ligament, and also upper and the medial edges or the medial margins of the olecranian process, upper and medial margins of the olecranian process, and some part will come to the medial epicondyle also. Okay, and here the capsule passes just below the annular ligament to attach to the posterior and inferior margins of the neck of the humerus also. So these are the attachments of the capsule, and medially and laterally the capsule is continuous. So this medially and laterally the capsule is continuous with the collateral ligaments. The capsule is continuous with the collateral ligaments, or the collateral ligaments will blend with the medial and lateral sides of this capsule. Okay, so now we will see in detail about this capsule. Here the capsule is fairly loose, large, loose and weak anteriorly. It is weak anteriorly and posteriorly. Both anteriorly and posteriorly the capsule is weak, and it contains some folds. The capsule contains folds that are able to expand to allow for a full range of elbow motion. So if the capsule is not loose or it doesn't have any folds. So if the capsule is tight, we can't get the full range of motion because of the folds, which helps the joint mobility, joint range. The joint range of motion is increased because of such kind of design of this capsule. Okay, because of the folds which are present in the capsule, which is located anteriorly as well as posteriorly, which helps to expand to allow for the full range of elbow motion. And also fat pads are located between the capsule and the synovial membrane. So as we know that the capsule consists of two layers, isn't it? So in between the synovial membrane and the capsule, you'll have fat pads. So what is the use of that fat pads? So these fat pads, which are located not it is present entire the capsule, it is only presented in certain locations. So what are those locations of these fat pads which is present between the capsule and ligaments, or which are adjacent to the olecranian fossa? So which are adjacent to the olecranian fossa, coronoid fossa and the radial fossa. Okay. So normally this fat pads will reduce the friction also here. That means it will give some support to that structure not to damage. Okay. The capsule synovial membrane lines the coronoid, radial as well as the olecranian fossa. Okay. And it also lines the flat medial trochlear surface. It also lines the flat medial trochlear surface and the lower part of the annular ligament. So these are the synovial lining which is present inside the joint cavity. Okay, and it is also having a triangular synovial fold inserted between the proximal radius and ulna. At the proximal radius and ulna, it is having a triangular synovial fold inserted between the radius and ulna and divides partly the elbow joint into two joints. Divides the elbow joint partly into two joints. Okay. And some of the investigators, namely Duparac and their colleagues, found that in majority of the joints which are examined in 50 adult cadavers, okay, the triangular synovial fold was located at the proximal radioulnar joint near the junction of the annular ligament and the joint capsule. The synovial folds varied from 1 to 4 millimeters in thickness, from 9 to 51 millimeters in length, and this synovial fold also contains fat pads and nerve fibers. Okay, because of this triangular fat pad divides this which separates the radius and ulna, and also partially divides the elbow joint into two joints. Okay, these are all about the joint capsule, which are surrounded on the elbow joint. Okay, and now we'll move on to the ligaments of this elbow joint. So the ligaments, mainly this ligaments helps in the stability of the joint, and it is a hinge variety of joint. Most of the hinge variety of the joints will have collateral ligaments. The same way, this elbow joint is also having collateral ligaments, and these collateral ligaments are located on the medial aspect and the lateral aspect of the elbow joint. And these collateral ligaments provide medial and lateral stability and to keep the joint surfaces in contact. Okay, so that is the main function of this collateral ligaments. So elbow joint is a hinge variety of joint. Normally this hinge variety of joints will have a collateral ligaments. So the same way this elbow joint is also having collateral ligaments, and these collateral ligaments of the elbow joint are located on the medial side and the lateral side, and these provide medial and lateral stability and to keep the joint surfaces in contact. The two main ligaments associated with the elbow joint are medial or ulnar collateral, medial or ulnar, and lateral or radial collateral ligaments. Medial or ulnar collateral ligament or and lateral or radial collateral ligaments. These are the two important collateral ligaments which are present in the elbow joint. Now coming to the medial collateral ligament. This medial collateral ligament consists of three parts. The medial collateral ligament consists of three parts. Here you can see the three parts here. One is the anterior part and another one is the middle part. This one is anterior part, middle part, and next one is the posterior part. Okay, now the anterior part stretches from the medial epicondyle. This one is the medial epicondyle here. It stretches from the medial epicondyle to a tubercle on the medial margin of the coronoid process. So a tubercle which is present on the medial margin of the coronoid process of the ulna. Okay, now coming to the posterior part. This one is the posterior part. The posterior part stretches from the medial epicondyle to the medial margins of the olecranian process. So this one which is present on the posterior aspect. Now coming to the middle part. So this is the middle part which connects the medial epicondyle to an oblique band stretching between the olecranian process. So this one is the olecranian process and the coronoid process. So olecranian process and the coronoid processes. So, and below this oblique band a gap is present through which a pad of fat covered with synovial membrane which is also protruding out. So that is the important thing which gives some cushioning effect because of this presence of fat pad. Okay, and now we will see in detail about this medial collateral ligament. So when the medial collateral ligament is dissected, if you see if the medial collateral ligament is dissected, so what will happen? It is going to separate as a proximal enthesis of the ligament and distal enthesis. So that means proximal some part is separated and distally some part of the ligament is separated. So to understand the attachment of the ligament on the proximal aspect, such kind of dissections have been done. And if it is when we see this proximal enthesis of the ligament, which is described as a round area on the flat portion of the anterior and inferior aspects of the medial humeral epicondyle. So this forms, so when we cut this one, so this forms a round area on the flat portion of the anterior and inferior aspects of medial humeral epicondyle, not condyle, medial humeral epicondyle. Okay. And this shows that, so the enthesis of the medial epicondyle, which are fused with the common flexor tendons as well as the humeral articular cartilage, where the ligament wraps around the articular cartilage of the edge of the trochlea. So normally the articulating surfaces of any joint, any diarthrodial joint will have an articular cartilage, isn't it? So that articular cartilage on the medial aspect is also attached with some of the fibers of the medial collateral ligament. So that is the attachments of the medial collateral ligament on the upper part, that is the proximal part. When you come to this distal enthesis, so on the distal side of the medial collateral ligament, so this will present on the coronoid process of the ulna, which is broad proximally and tapers distally. So that means proximally it is broad and distally like this. So when it cuts, so the upper part becomes rounded like structures, whereas the lower part, the distal part, in the distal part proximal process is what you call as expanded and broad, and it one is at the distal end it tapers. Okay. With fibers of the ligament crossing the coronoid process and inserting further distally on the proximal and medial ulna. So this attachment shows that the fibers of the ligament crossing the coronoid process, so which are crossing the coronoid process, also inserting further distally on the proximal here, on the proximal and medial side of the ulna. This type of spread out of insertion at an enthesis is also known as mechanism for distribution of stress. Mechanism for distribution of stress. So that means, so if it is present like this only, so here the stress may be concentrated. If such kind of spreading of these entheses, so the stress are going to be spread like this. So such kind of insertion is called as mechanism for distribution of stress. Okay, so for that only we have to understand the attachments of these ligaments, how these ligaments are attached. As we people know that anatomically from here to there these ligaments are attached. What is the purpose of these attachments? So why such a kind of attachment is seen here? So because it helps in the spread out type of insertion at an enthesis is also a mechanism for distribution of stress. That means, so this ligament is going to support such kind of stresses. Normally on the medial side, valgus stress. The valgus stress is take over by this medial collateral ligament. Okay. So The mechanoreceptors like Golgi organs, Ruffini terminals, Pacini corpuscles and free nerve endings are also densely distributed near the ligaments, humeral as well as the ulnar attachments. So at the humeral and ulnar attachments, more mechanoreceptors are present. Okay. So this is the entire function of this medial collateral ligament. That means it is going to handle the stress on the medial aspect, that is valgus stress. Okay. Now we are going to see the individual function of this fibers which are present in the medial collateral ligament. As we know that it is having three ligaments. One is the medial collateral ligament and also the posterior part and the middle part. So here we are going to see these parts as bundles, that is anterior bundle, posterior bundle and the middle bundle of this medial collateral ligaments. So how these bundles are going to work. Okay, now coming to the anterior bundle of the medial collateral ligament, which is considered as primary ligamentous restraint of valgus stress. So this is the main bundle of the medial collateral ligament which is going to handle the valgus stress from 20 degrees to 120 degrees of elbow flexion. So during this 20 degrees to 120 degrees of elbow flexion, the stress is going to handle by this anterior bundle of the medial collateral ligament. That means it is the primary ligamentous restraint of the valgus stress from 20 degrees to 120 degrees of elbow flexion. And this ligament is overlaid by, so as we have seen that this ligament will have some attachments with the common flexor tendon. So mainly this part, anterior part, is overlaid by the flexor carpi ulnaris, pronator teres and flexor digitorum sublimis muscles. So these muscles are overlaid over the anterior bundle of the medial collateral ligament. Okay, and some of the investigators like Callaway and colleagues describe this anterior bundle as consisting of an anterior band as well as the posterior. That means this anterior bundle still it is having, and it is divided into anterior band and posterior band, which are going to tighten in a reciprocal manner as the elbow flexes and extends. So these bands will work when the elbow flexes and extends by tightening these bands during these functions. The anterior band of the anterior bundle of the medial collateral ligament was found by these investigators to be the primary restraint of valgus at 30 degrees, 60 degrees and 90 degrees of flexion. So the anterior band of the anterior bundle of the medial collateral ligaments acts as a primary restraint of valgus at 30 degrees, 60 degrees and 90 degrees of flexion. After that, this anterior bundle acts as a co-primary restraint up to 120 degrees. Okay, so this ligament acts as a primary ligamentous restraint from 20 to 120 degrees, isn't it? So from 30 to 90 degrees, the anterior band of the anterior bundle of the medial collateral ligament acts as the primary restraint of valgus at 30, 60 and 90 degrees of flexion. And for the remaining degrees, the anterior band acts as the co-primary restraint up to 120 degrees. Okay, the anterior capsule and the radial head also make some contribution to medial joint stability, but these structures fail to provide stability against valgus stress when the anterior bundle is cut. So even though the anterior capsule and radial head have some contributions on the medial joint stability, but if the anterior bundle is cut, these structures are not able to provide stability against valgus stress. So this is about the anterior bundle of the medial collateral ligament. Now coming to the posterior bundle of the medial collateral ligament. So this posterior ligament, posterior medial collateral ligament is not that much, this one is the posterior medial collateral ligament, which is not that much having such a distinct function as that of the anterior bundle. And sometimes these fibers blend with the fibers from the medial portion of the joint capsule. The posterior bundle extends from the posterior aspect of the medial epicondyle of the humerus to attach the ulnar, coronoid and olecranian processes, and it limits the elbow extension, but it plays a less significant role than the anterior bundle in providing valgus stability for the elbow. Okay, and that means the posterior bundle having a function that limits the elbow extension, and it is having less significant role in maintaining valgus stability. And coming to the medial collateral ligament, that is the transverse fibers. So these are the transverse fibers which are extending the olecranian and the ulnar coronoid process. So extending from the olecranian and the ulnar coronoid process like this. These fibers, so this portion of the ligaments will provide very little valgus stability, but may help to keep the joint surfaces in approximation. So this is the function of this transverse ligament. So these two ligaments will have less function in maintaining the valgus stability of the joint. The anterior medial collateral ligament is having major function in providing the joint stability on the medial aspect. Okay, so a repeated valgus stress on the medial collateral ligament occurs during many activities, but injury to these ligaments will take place most frequently during backswing position. That means backswing position of pitching. That means when the shoulder is externally rotated and elbow flexed, and it is also present on the back side. Shoulder is externally rotated, elbow flexed, and which is present on the back side of the trunk. And when the person started pitching, so in that position of pitching, back swing position of pitching, this medial collateral ligament is going to be affected. So the major function of this medial collateral ligament is which stabilizes the valgus torques at the medial elbow, and it limits the extension, elbow extension, and it guides the joint range of motion throughout flexion range, and it also provides some resistance to longitudinal distraction of the joint surfaces. So these are all the major functions of the medial collateral ligament. Now coming to the lateral collateral ligament. So this lateral collateral ligament is also considered as a complex here. So this complex forms with the two important ligaments and a small amount of other ligament, so which includes the lateral or radial collateral ligament and the lateral ulnar collateral ligament, and also the annular ligament. So these are the ligaments here. So if you can see here, this is the lateral epicondyle and this one is the annular ligament. The green one is the annular ligament, and it consists of lateral collateral ligament. The pink part is the lateral collateral ligament, and this one is the yellow part is the lateral ulnar collateral ligament, and some part of the annular ligament. All these called as the lateral collateral ligamentous complex. Okay, and for this one also having an individual function. So this lateral radial collateral ligament is a fan-shaped structure. The lateral collateral ligament is a fan-shaped structure that extends from the inferior aspect of the lateral epicondyle of the humerus. It is going to merge with the annular ligament. Okay. So this annular ligament, you people know that this one encircling the head of the radius. The ligamentous tissue extending from the lateral epicondyle to the lateral aspect of the ulna and the annular ligament is referred to as lateral ulnar collateral ligament. So you have to see the difference. The lateral radial collateral ligament is extending from the inferior aspect of the lateral epicondyle, whereas this lateral ulnar collateral ligament is extending from the lateral humeral epicondyle itself and to the lateral aspect of the ulna and the annular ligament, which is referred to as lateral ulnar collateral ligament. And this ligament adheres closely to the supinator, extensor and anconeus muscle that lies posterior to the lateral collateral ligament. And these also having some individual functions. The lateral radial collateral ligament, this one, provides reinforcement for the humeroradial articulations and also offers some protection against varus stress in some positions of the elbow, and it is also providing resistance to the longitudinal distraction of the joint surfaces. And also some fibers of the lateral radial collateral ligament remain taut. That means it becomes tight throughout the flexion range of motion, whether it may be either varus or valgus movement is applied. Okay. And it is described as the lateral radial collateral ligament is described as a key structure that is always disrupted in elbow dislocations. So this is the structure which is always disrupted in elbow dislocations. Okay, coming to the and also some of the investigators concluded that the lateral radial collateral ligament is the primary soft tissue restraint, and this one is going to be which one? The collateral ligament and the annular ligament, or the secondary restraints to combined forced varus and supination stresses and forced valgus stress. forced valgus stress. That means if you bend the forearm towards the lateral side, and these are the structures which are going to help acts as a secondary structures. So the primary structure which helps in the varus stress on the lateral collateral ligament is the radial collateral ligament, whereas the lateral ulnar collateral ligament and annular ligament acts as secondary restraints to the combined forced varus and supination stresses and forced valgus stress. Okay, so these are all the functions of the lateral collateral ligamentous complex. Okay, and this lateral ulnar collateral ligament, though it is not a major restraint, but it also contributes the posterolateral stability by securing the ulna to the humerus. So it also gives posterolateral stability. This lateral ulnar collateral ligament will give posterolateral stability and by securing the ulna to the humerus, and it also provides support to the annular ligament. And some of the investigators suggested that this lateral ulnar collateral ligament is not a static stabilizer, but it acts as a dynamic stabilizer together with related muscles. Along with some of the related muscles, this lateral ulnar collateral ligament acts as a dynamic stabilizer. So these are all the functions of the lateral collateral ligamentous complex. So these are all about the joint capsule, structure and their function, and ligaments, their attachments and their functions. In the next session, we are going to see the function of the elbow joint. Thank you.